I'm Dr. Charles from PHI Preventive Health Institute, and today we are looking at what it really means when symptoms persist after treatment for PID, and why feeling a bit better is not the same as being fully recovered. There is a way this usually plays out. Treatment is completed, the pain reduces, the discharge improves, and then a decision is made to just wait a bit more. It will clear completely on its own, but the pattern tells a different story. Because in PID, recovery is not always linear. It is a system response, a response involving infection control, inflammation resolution, tissue healing, and restoration of normal reproductive balance. And each of these does not switch off at the same time. So symptoms may reduce first while healing is still ongoing underneath. That is why ongoing symptoms must be interpreted carefully. Let's break it down. After treatment, some residual discomfort can be expected. Mild pelvic discomfort may linger. A small amount of discharge may take time to fully resolve. This can happen as the body clears inflammation. But here is the key distinction. Recovery means gradual improvement, not stagnation, not worsening. So the first pattern to watch is trend. Getting better is expected. Staying the same is a warning. Getting worse is a red flag. Now let's look at what often disrupts recovery. Incomplete antibiotic courses, missed doses during treatment, stopping medication early once symptoms improve. Each of these does one thing inside the system. It reduces pressure on the infection but does not eliminate it. So bacteria may persist at a low level, and that leads to a second pattern. Symptoms do not disappear fully. They linger, they return, or they change form. Now bring in another layer, reinfection. If a partner is not treated when required, the system resets. So what looked like persistent infection may actually be a cycle restarting. That is why PID is never just one-person management. It is a shared system issue. Now step back and look at what clinicians watch closely after treatment. Ongoing lower abdominal pain that does not steadily improve. Foul or unusual discharge that persists. Fever returning after treatment. Pain during intercourse. Irregular bleeding that continues. These are not normal recovery signals. They are system signals. They suggest one of three things: incomplete clearance, reinfection, or ongoing inflammation requiring reassessment. And here is where many people get misled. They assume end of antibiotics equals end of disease. But in reality, treatment is only one phase. Follow-up is the second phase. Because the goal is not just symptom reduction, it is confirmation that the system has stabilized. When follow-up is missed, a silent pattern can develop. Mild symptoms persist, damage continues quietly, and complications appear later, sometimes more severe than the first episode. So the key shift is this. You are not just waiting for symptoms to disappear. You are confirming that recovery is complete. Final layer. Persistent symptoms after PID are not something to ignore or normalize. They are information. And how you respond to that information determines long-term reproductive health outcomes. So the pattern is simple. Do not assume recovery. Do not delay review. Do not ignore persistence. Complete treatment. Observe the trend. Return for reassessment when healing does not clearly progress. Because in PID, timing matters and early correction prevents long-term damage. Need guidance? Contact your healthcare provider for proper evaluation, or call or WhatsApp +233 208 720 347